Dr. Kishore, thank you so much for joining today. And thank you for helping all of us address the question about third wave, because there's so many questions, concerns, speculations, worries, especially as we are told that third wave would impact children. And I really want to, before we get into that, want to understand from you what change between first wave and third wave, and why are we saying that this will be more dangerous for kids, for children?
Shraddha, that's a very, very good question, and it's very close to my heart. So first of all, I'll answer that in two bits. The world has had quite a number of pandemics, and if you look at all the pandemics, we always say history teaches us. And if you look at the history, nobody could predict the pandemic.
Yeah.
If somebody could predict the pandemic, we would have had many people predict what happens, when it happens, where it goes. And that's why all the predictions are coming wrong. So basically, pandemic cannot be predicted. Now, the reason why people are saying the children will be affected is if you look at the first wave affected predominantly elderly and people with comorbidities. And that's why the vaccine, when it came out first, was focused on that age group. Now, but there is a difference. When the first wave happened, when we quarantined in a family, people escaped infection. Now, when you look at the second wave, the variant of mutant virus was behaving differently. What we noticed is, doesn't matter how much of quarantine and how much of precautions anybody took in any family, one member got infected, everybody got infected.
Yeah.
And that was very, very common in the second wave. In fact, we saw a whole lot of families being positive, which was very unusual compared to the first wave. Now, because second wave was not predicted, people have gone overboard and said third wave will happen and affect children. The reason for that prediction, it's a wrong prediction, is because they thought the first wave affected elderly people, second wave affected predominantly between 30 and 50. So third wave will affect predominantly less than 30. There is nothing, it's not a mathematical calculation which you can do. One thing is true. See, the vaccine protects everyone from death and a serious disease, but it doesn't protect you from getting infected. And that's where people talk about 70% efficacy, 80% efficacy, 90% efficacy. What it means is if you vaccinate 100 people, 99.9% nobody will die with the vaccination, but they will not get serious disease, but they may still get mild disease. So it is important for us to vaccinate everybody, and children will get disease only if adults get the disease, the family. Okay. So if you protect the adults and you are responsible with the responsible behavior, when you go out, wear a proper mask, come back, wash your hands, maintain social distance till you have a shower or whatever, then there is no reason why children should get infected. So this prediction that it will affect only children is wrong. Children cannot get infected unless the adult get infected. And I think already the children are quite anxious. In fact, I have had in my clinic many 4-year-old, 5-year-old coming with going to die. So the anxiety in children is very, very high. Putting this pressure on the parents and creating more anxiety in the parents is unwarranted.
Just saying this, that it's not that some mutant variation will come and attack children. Basically, as an adult, if I get infected, then the children have the chances of getting infected.
Absolutely, absolutely. That's why we actually advocated the vaccination for pregnant women and lactating mothers way back in early May. But the government regulations and everything came only recently. July 2nd, I think it came. Because see, what is happening is we are seeing a lot of pregnant women who got infected, delivering babies who are suffering from what we call as a MIS, that is multi-inflammatory system disorder in the newborn. So typically what happens is somebody has a COVID, 4 to 6 weeks later, the baby gets infected. And if the children get COVID also, the chances of them getting MISN or MISC we call, after 4 to 6 weeks is a possibility. but it's still very rare. I mean, the morbidity in children is very, very less compared to adults, because adults have hypertension, diabetes, obesity, chronic obstructive pulmonary disease, various things. I mean, if the morbidity is there in children like leukemia, asthma, heart disease, they will also get probably affected a little worse than the normal kids. But majority of the children will not come with gasping for oxygen, gasping for air. That's unlikely to happen in children because they have angiotensin converting enzyme 2 receptors much, much less in the lung. So, plus the regeneration of lung capacity is much quicker. So they are not going to suffer like what we saw in second wave. But it is a fear because the disease, if it affects children, 4 to 6 weeks later, it can cause MISN or MISC, depending on the age. And that's possibility, but it's a rare possibility. It's not like every child who gets that will affect that.
There's so many miscommunication and there's so many scary things floating around. And sometimes I see it across social media everywhere. What are some of the myths that you would like today viewers to, say that, okay, this is not like something that you should worry about?
See, the first wave happened in the UK and USA about 2-3 months earlier. And everybody thought India has escaped. And they started telling India gives BCG, we use turmeric, we use MMR vaccine. That's why Indians are not affected. Then down, suddenly everybody got infected. All the theories went out.
Yeah.
The second wave, people were overconfident. And because there was a slight delay in affecting people compared to Western part of the world, a lot of people said, oh, I'm using steam inhalation. I'm using ghee in my nose. I'm using lemon juice every day. Those people who talk like that are dead now because they were overconfident, and overconfidence is what kills you because you go and expose yourself to the risky factors. And that's exactly what is happening with the vaccination too. People who get vaccinated think that they're protected completely and they start behaving irrationally, not wearing a mask, and they put their family members into risk because when you are vaccinated, you are protected from death and serious disease, but not from infection. Your chances of having a asymptomatic infection is much higher. And then you carry that infection from outside, go inside, infect the family members, and they'll end up in problems. So it's very, very important that even if you're vaccinated, your behavior should continue to prevent COVID infections because we are a pandemic. Pandemic fatigue is not an exclusion because excuse because everybody gets tired of the precautions they have to take. And that's what leads to pandemic fatigue. And that's a bad thing to do. So the myths are too many there, and that myths have to be busted.
What are some of the symptoms which I should, as a parent or as an elder, be wary of and then say that, oh, my kid has COVID symptoms? Like, what are some of the things that I should be watching out for?
The thing is, see, we are in the midst of monsoon. And monsoon is a time when children usually get a lot of viral infections. And also India is a noted hub for dengue, typhoid, and malaria and other things. So the normal infections which affect children will affect this year too. Just because pandemic is there, it doesn't mean that normal infections will disappear.
Yeah.
So everyone has to remember, every fever is not COVID. Now, I always tell the parents, when they call me and say, my child has got fever, what do I do? Is it COVID? COVID is unlikely to affect children first without affecting the adults. If in the family, everybody is healthy, all the adults have no fever, only child has got fever, then it's unlikely to be COVID from the simple perspective of exclusion.
Yeah.
If adults had fever 3-4 days ago, then the child gets fever, then that is a possibility that it's a COVID. So if children get fever first, more likely they have other causes of fever and you need not panic. And second thing is most children will get mild infections like cold, cough, fever, which lasts for 3 to 4 days because COVID is also a virus infection and it usually disappears by the end of the week. First week of illness, nobody lands up in problems, even adults. Whoever lands up in problems is usually second or third week of the illness, when the inflammation in the body takes over and there is hyperinflammation. That's when the side effects and other manifestations happen. So as long as everybody is okay for the first week, then you need to watch out for the second week. If you start developing more symptoms, that's when you need to see the doctor quickly. So panicking doesn't help. Definitely staying calm will help.
What can parents do? What can elders do today to ensure? See, nobody can have 100% safety net or whatever. But what can they do so that children are safe as much as they can? Ensure that they don't catch the virus. What should they do?
Yeah. So number one, I think you need to stop watching electronic media every day, especially in front of the children, because the media has been not positive. And when you see a lot of negative news that has effect on the children, see, you need to know the information. So to know the information, the best thing to do is dedicate your 5 or 10 minutes in isolation, read it in social media or on the website from a reliable source. When I say a reliable source, something like CDC or Government of India or ICMR websites, where authentic information is posted.
Yeah.
And that gives you the information what is happening in the world. Seeing the electronic media day in and day out not only exposes children also for the negative feeling, thinking that they are going to get affected. So number one, stop watching electronic media. Number two, continue wearing a mask and maintaining social distance and washing your hands when you go out. Minimize the risk exposure when you go out. Try to stay as much as possible without traveling, at least for the next 6 months. Most of the pandemics have lasted for 2 years. Anything less than 2 years is very, very optimism. And the best example is China thought they have overcome, and you can see China is now back in the news again because everybody has been infected, a lot of people. So the lockdowns have started. So December 2019 is when pandemic started. The earliest we can hope of any remedy from relief from the pandemic will be December 2021. So I think we have to continue to remain vigilant. We should avoid travel. And just because you're vaccinated doesn't mean that you should not wear a mask, because your risk to others is much higher. And maintaining these sort of basic principles will protect children both from physical illness and mental illness.
Yeah. Dr. Kishore, in the West, they are giving vaccine to young kids, to children. And in India, government has said that from September onwards, I think, that they will look at vaccination for kids above 12 years of age. What do you think should we be doing? And when do you think we'll have vaccine for everyone?
That's a good question. See, the Western vaccine is made of mRNA vaccine, which has not been tested for a long-term safetiness for anybody, including older age group. Now there are reports in academic journals that this vaccine, when it's given to young children, is causing inflammation of the heart, or what you call as a myocarditis. So the vaccine which is safer in adults may not be safe in children, especially the newer generation. The good thing about Indian vaccine, especially the Covaxin and Covishield, are a technology based on the old technology. In other words, Covaxin is a killed virus. Covishield is basically a adenovirus vector. Both these have been tested for quite some time in various diseases. So in other words, the safetiness of these vaccines is much easier to prove, because Covaxin method is nothing but flu vaccine technology. So we give flu vaccines to children regularly. So I think once the safety is proved, which will come out in the end of August or September, we should definitely have a vaccine for children in either October or November. And I feel every parent, as soon as it's available, should be given that vaccine, and that way it's protection.
And what would you say for pregnant women? What should they be doing?
Pregnant women definitely should take the vaccine. I have been advocating almost for the last 2 months that pregnant women should be taken, because we have seen in our hospitals lot of pregnant women who have suffered COVID, having babies born with the MISN, and that can be avoided by taking the vaccine. Vaccine is reasonably safe. And as I said, the technology used in the Covaxin and Covishield is a old technology which has been used in the past. So there is no reason to believe that it's harmful. One has to think of the benefit versus risk ratio. If anybody gets COVID during pregnancy, the risk of the COVID is much higher than not having the vaccine. So on that basis, everybody who is pregnant should take the vaccine and protect themselves. It's always counting the benefits versus risk ratio. A lot of mothers ask, will I get problem this? Will I get that? And the answer is, yes, there may be mild side effects, as we know, like fever, body ache, shivering, and other things, but that's temporary. That's better than having your baby suffering from multi-inflammatory system newborn disease.
Dr. Kishore, do you think we are ready? Ready in the sense we will never be ready, but are we comparatively better prepared for the third wave? And what do you have to say about pediatric healthcare infrastructure in our country as of today?
The pediatric infrastructure in the country is reasonably robust. And in fact, we have very good pediatricians around the country, except in few states where the pediatrician number is less. Otherwise, most of the cities and most of the towns are well equipped with pediatricians. And what you have to look at is 1 in 1,000 children will get a serious disease, not everybody. And even if that were to happen, if a good triaging system exists, we have enough number of beds. What happened in second wave is mal-distribution of the beds. A person who needs a simple oxygen occupied an intensive care bed in a multi-specialty hospital, blocking the bed. And that should not happen. So good triage system, referring children who really need admission to the proper centers, identifying those centers will go a long way to cater. But having said that, I'm telling this again, only children will not be affected. Adults affected will lead to children. And there is no reason to believe only children will get affected. And the latest survey of ICMR done in quite a few states indicates that 67.9% of Indians are seropositive. That means we have only 33% of people who are not infected. That leads to 40 crore population who are not been infected or not been vaccinated. So we have a potential target by the virus for 40 crore people. Unless they're vaccinated quickly, we will have a third wave. We will have a third wave. And the only way of preventing that is responsible behavior, which I don't see in most adults, unfortunately. So if we get tired of the pandemic behavior, that means not wearing the mask properly, not washing the hands. Remember last year, how careful everybody was. They were washing the vegetables, they were washing the hands thoroughly. I don't see many people washing their hands. Many people don't even wear masks when they come to the hospital. They think that pandemic is gone. So irresponsible behavior will lead to the third wave. But if you are careful, if you vaccinate quickly, see, when the second wave happened, there were long queues for vaccination. Suddenly, the queues have disappeared, not because of the shortage of the vaccine. People are thinking that it's come and gone. I don't need to get vaccinated. So that sort of a vaccine hesitancy and risky behavior, risky exposure will lead to third wave. So if we are careful, we follow the rules and regulations which has been known to us, then we can avoid the third wave.
Dr. Kishore, how is Cloud9? How have you prepared and if I may ask, protected your healthcare workers with the thing about third wave around the corner? What have you done?
That's a very good question. From day one, what we have done is we have instituted preventive protocols. We allow only one attender with one parent or one attender with one husband. And that has led to a lot of people getting angry. In fact, I can clearly remember in May 2020, one of the grandfather came to visit the grandchild, and he was 76. When we didn't allow him inside the hospital for their own safety and our safety, they cursed our hospital and went home. And we said, look, it is purely to prevent exposure. And at that time, we didn't even have a vaccine. So we have been from day one very, very strict with our protocols. We don't allow more than one visitor. And we have a very, very strict protocol. We supply all our employees, whether they're housekeeping or security or nurses or doctors, with the N95 mask from day one. And we regularly change the N95 mask every 2 weeks or every week as per the protocol, as per the usage. And we have strictly maintained hand washing. As soon as the vaccine became available, when healthcare workers were given vaccine, 100% of our staff have been vaccinated in all the centers, and all have been issued their certificates as per the government of India. So there is no cross infection in the hospital. We are maintaining very, very strict protocols to keep the public safety, of course, and also the staff safety.
What can we all do as people, as community, to ensure that the kids, as you're also saying that today kids are anxious, right? And then they are getting to know from here and there that this is going to affect kids. What can we do as community to make sure that our kids stay strong and not get stressed with this?
I think this has given a golden opportunity for all the parents to spend quality time with their kids, and working from home has given the flexibility of the hours. So most parents have forgotten how to raise their children. So good time to practice parenting, spend quality time with the kids, read news, read stories, read, whatever their mythology, whether Christian, Jain, Buddhism, Hindu, whichever religion you are, it's a good time to teach some religious ethics. Not because I am a religious person, I'm just saying that religion brings principles into everybody's life, and I'm not supporting any particular religion. As parents wish, they can teach. It's a golden opportunity for them to keep them engaged in a different aspect rather than watching TV every day, and spend quality time with them every day, and read whatever you want and play games, because this sort of a time will never ever come to you. And the more you utilize this opportunity for bonding between the families is the best thing, and that will avoid the mental anxieties and illness in any family. And you are free to practice whatever you want within the four walls. It's not like you have to go out. And there are many things that can be done in the family, many things, and they can do all that. You just need to have to think, one day I will do reading the stories. It can be comics, it can be fun stories, or it can be mythology, and then play games. There are lots of indoor games you can play. I'm sure people have forgotten how to play the indoor games, and all those games can be played, and all of us can together do some sort of exercise to keep ourselves fit, and teach the kids how to cook, how to help. All that can be done. There are lots of things that can be done to keep them engaged rather than grumbling and leading to their mental anxieties.
When you were doing MBBS, how come you chose to be a neonatologist? Like how did you choose this specialty? And today, this, we're discussing, because everywhere we are talking about children and third waves. I have to ask you, what got you to choose this specialty?
Yeah, when I was doing MBBS, I got inspired by one of the professors whom I was working. And the most important thing is I used to see a lot of children die every day. And I thought, becoming a pediatrician, we can save a lot of children. And subsequently, when I became a pediatrician, I realized that a lot of babies were dying. And in fact, when I was doing post-graduation, any baby less than 1,000 grams, if it survived, was a big talk of the town. And hence, I wanted to specialize in neonatology. At that time, there was no neonatology specialist training in India. That's why I went abroad to train myself as a neonatologist. And I'm glad I did. And we established Cloud9 with the dream of saving the smallest babies. And the smallest baby we have saved so far is 400 grams. And we have a 99.3% survival for premature babies
Wow.
irrespective of
Wow.
the size and gestation. So we have achieved a lot in Cloud9, and we want to replicate the same success all around the country, whether it's a public or a private center. Hopefully, we will do that in the next few years.
Thank you. Thank you so much, Dr. Kishore. And I'm sure everyone, every adult watching this today will agree with me that this is very, very important. Thank you. Very useful information and very generous of you for taking out time to talk to us. Thank you. Thanks a lot.